episode number.
That means we can do a real high five. Yes. All right.
All right. What are you excited to hear?
About who?
Oh.
Who are we talking to and what is it about?
Dr. Matt Thompson.
Our first doctor. PhD. Do doctors have PhDs? Is that what that's called?
MDs.
Oh, duh.
Anyway.
Yeah.
Let's just sidestep that one.
Yeah. Edit that out, Andy.
All right. So Matt Thompson, he is one of the founders for Telescope Health. I'm excited to hear about it. I don't want to give too much away, but for me, what I understand is he's doing something that for people who don't have to have health care, and there's an insurance of you will still be cared for. I want to dig into what that means. Right,
because his company, they focus on 360 Care. As a telemedicine company. And they have an agreement with the city of Jacksonville to provide healthcare to those who need it.
Right.
And that's pretty incredible. And it's free of charge.
And it's things like that you wonder, is this too good to be true? What's the catch?
Yeah.
I don't know.
And he's an ER doctor, so I want to hear some ER stories.
I want to know what his personality is going to be like, because the whole doctors can have that rough and gruff bedside manner, and that's why we have nurses, because they're
First impressions, I don't think he has that. Do you think he has that?
I don't think it's possible.
Because we had an intro call with him.
We did. And that's where it's kind of hard to believe. Not that we're questioning his intelligence, but it was hard to believe. You're an ER doctor?
Yeah.
I feel like he could be center stage on Broadway. He's very charismatic.
Yeah. That's great. Let's talk to him.
Let's do it.
Yeah.
I'm right here.
Yeah.
You are right.
How are you?
Hi, Matt.
It's good to see you.
Yeah, good to see you guys
Yeah,
too.
good to meet you in person. Thanks for coming in and on our show.
I'm really happy you're here because every night I get heartburn.
Yes.
And I take baking soda to solve it. So is that going to kill me?
Yeah, we're going to debunk all the medical myths today. I see what's happening here. This is your free medical consultation.
Yes,
right?
that's why we brought you here.
Turns around and lifts his shirt to tell you he has a suspicious object to look at.
Yeah.
The knife in my back that Jen.
See, now that actually is exciting for me because I have lots of stories about popping those things, and it's a lot of fun. So,
do you have a YouTube channel where you're popping?
I don't, but I have a memory of YouTube-worthy events that have occurred. But I'm just going to say really quick. Your heartburn, you told me right before this started that you just opened a jar of queso. And so...
That is a rare occurrence.
Ask him about the coffee addiction, too.
Oh, yeah. I have a
coffee
addiction. Yeah,
everyone does. It's America.
I'm a
How do you
coffee
survive?
freak. I'm a coffee snob, actually. I got an espresso machine. And
are you roasting your own beans?
I don't, but I have a buddy. I have a source.
You have a source.
He knows who he is.
I roasted my own beans in my air fryer.
Oh,
really?
It worked.
Yeah,
it worked.
Did it taste? So we put a lot of fish sticks in our air fryer. So I think, probably that would not be a good flavor.
Oh,
for coffee.
A doctor that eats fish sticks. I feel like that should be discussed.
No. Okay, I didn't say I eat the fish sticks. That was my second. That was my redheaded child.
Right, exactly.
Actually, she eats the fish sticks.
Awesome.
Yeah,
that's great.
Well, it's great to be here, though.
Are we going to just jump into the game, or should Matt talk about?
I need to know more about Matt first.
Yes. Okay.
Because I feel like we'll spend all the time talking about all of the fun stuff, but I think there's some interesting things about his background.
Yeah, like what? Yeah. What did you want to do when you were a kid?
Yeah.
Oh, so I always wanted to be a musician, professional musician, and I am a musician. But I was really into. So I play a lot of different instruments: guitar, piano, drums. Ukulele and xylophone. So I was a big xylophone player, and that kind of got pushed into that in high school. And then I had a chance to go to.
Almost made a high school band joke too.
Yeah. Oh man.
Really
so I was I ran the full gamut. Okay. I did some cool music stuff too, but I was also a band geek, and so I almost went to University of Kansas, which is where I went, but on a xylophone scholarship. And I'm glad I didn't, because that would have put me on a very different, weird trajectory. No offense to the xylophone players out there.
Can we just stop?
Yeah.
That is by far the most interesting thing I think we've heard on the podcast.
I got a lot more.
It almost feels like the cliche joke of the underwater basket weaver degree.
Yes. Yeah. Yep. Yeah.
So there's probably way more skill required to play a xylophone than I would ever
for
realize.
sure.
Yeah.
So we should have brought a xylophone. We should have brought a xylophone.
Yeah, I have one in my car, actually.
Go get it.
No, I don't really. But yeah.
I believed you for a split second.
Yes, yeah. Maybe I should have one. But
So you turned down the xylophone
I
scholarship.
did. It was
'cause
really
you're like,
hard
"There's
decision.
too much money
that
in
was
this."
a fork in the road for me. And at the same time, I was like, do I want to be a doctor? So no, I mean, I saw.
Did your
Pat,
parents sit you down and have a talk before you took the scholarship?
They pushed me towards that. They were like, you got to do it, man. That's your calling. But it didn't work out, sadly. But, always time for a second career.
That's true.
Telescope health thing doesn't work out. I'll go back and try that out. But no, so, I mean, did you guys watch Patch Adams when you were a kid?
Yeah.
Yeah, so, I mean, that movie, I love people, to be honest with you.
Wait, is that the Robin Williams movie?
Yeah.
It sure
yeah,
is,
okay.
yeah.
Rest in peace,
Okay.
Robin.
Okay.
But, I love people and I love science. And so at the time I was like, I want to be a doctor. And then you go to college and I veered courses to psychology. Actually, I was going to go to grad school in psychology. Cognitive behavioral therapy was like a really cool area that I loved, and did a lot of research there. And then ended up going to med school instead. I'm really glad I did. And then, fell in love with technology, really informatics, went to residency and did a fellowship in ultrasound and informatics after residency in emergency medicine. And
In informatics?
informatics, yeah.
What is that?
Informatics is, the use of data and technology in healthcare. So when you go to have a visit with a doctor, there is a medical record that tracks you as a person, your demographics, the care delivered, your outcomes. And so informatics is really the study of using that information in the purpose of healthcare. And so, for me, was really centered around ultrasound. So I'm an ER physician, right? So I loved ER medicine. I love multitasking, seeing lots of different conditions, and the ability to just walk into the room and talk to somebody you don't know and hopefully solve a problem. And then, ultrasound, we use ultrasound just like you do if you are looking at a baby and it's, a lot of what we use it for is like those cysts you're telling me about on your back, that you want me to look at. So boom, you pull an ultrasound machine.
Should we do it on the show or after the show?
Yeah, we can do it on the show. And so that was really a big foray into use of software as a service. I remember downloading, just testing APIs, working with the electronic medical record and finding ways to bill for ultrasound and learning how health systems use, that technology in different softwares. And so I just developed a big love for technology, I guess, and software as a service, really. And then moved to Jacksonville and led the ultrasound division of our company and worked with Baptist Health to start emergency ultrasound. And then,
so are you in the ER room during this whole time?
Yeah, so I was an ER physician during this time, and I was working, at multiple Baptist facilities, so Baptist Downtown, Baptist Beaches, and then also it used to be Flagler Hospital, worked down there, and that was, see a lot of crazy stuff down there too. And then, in 2017 or 2018, our group said we want to look at telemedicine because we have a lot of patients who come to the ER. Then they leave, they need follow-up care. Telemedicine might be an option. And so I was tasked with kind of starting that division of our company. And then we spun that off into a separate entity, and that's where Telescope helps us.
So you started it with Baptist?
Not with Baptist. Baptist was a client of ours, but we started with Emergency Resources Group, which is when you go to the ER at Baptist Health, you see a doctor who's actually is a part of Emergency Resources Group, just like I am.
Okay.
And, so it's the ER staffing company.
Okay.
And so they are our parent company, Telescope's parent company. And so it's really neat, like the DNA of Telescope, my company is really born out of a group of ER physicians, so it's very different than maybe a company that was founded in Silicon Valley or out of VC funding. And so we had a pretty deep understanding of how does healthcare actually work in the ER?
Right.
What's the patient journey like? What are the pain points? And but I'll say there's a lot of things that didn't know or understand as well. And it's been a very interesting journey learning about what do patients really experience? What is the business of healthcare? And how can we make improvements? How does public health intersect with all of this? And so it's really cool. Our company's evolved and changed so much. The technology has grown. We have an amazing data analytics team, brought on all these smart people that, are experienced in different aspects of healthcare business. And so it's just, it's cool. I've learned so much, you realize as a doctor, you're I love to say I'm the dumbest one in the room because you have all these amazing intersects of people that build the company.
So the company Telescope Health.
I'm
sorry, Telescope Health.
Yeah.
Was born out of the idea of having aftercare for the patients when they come to the ER?
Yeah, I was really born out of so I'll give you an example. If you go to the ER at 3 p.m. on a Tuesday, okay, and
Which is the best time to go.
It is, yeah. Actually, it's the worst. So Monday's the worst time to go by far, just so everybody knows out there. Mondays are typically the busiest time to go.
Is that
nobody
because-
wants to go to work on a Monday. And so, and also the weekend, people typically tend to, delay care because it's the weekend, they're at home, they're resting, and then they realize, I got to go back to work. No, can't, or school can't. And so Mondays are usually very, very busy. So,
that is so good to know.
Yeah,
What are Fridays like?
So Fridays, typically Friday afternoons, I mean, you probably can guess, a little less busy, just because, people
But
are going.
Friday at midnight?
Yeah. So
Is that crazy or no?
Yeah. Well, it depends on the location also, right? So again, urban centers, places, so we have multiple ERs in this city in Jacksonville, right? And some are located near bars, restaurants, universities.
Yeah, they might see an uptick at 2 a.m.
Yeah, exactly. Yeah, so it just depends. The more rural locations, obviously not going to be as busy.
Okay.
But, okay, where are we going with this? You guys are going to have to keep me on track.
Why
here.
did you, how was it born? What was the purpose?
Yeah, so the purpose really was to definitely, you're in the ER Tuesday. This is where I was going with the story.
That's right.
3 p.m. on a Tuesday.
Not 3:30.
So this is in the afternoon. If you're uninsured or you, even if you have insurance, you may have resources, you may not. It's guaranteed that if I tell you as an ER doctor, I'm going to take care of you, you need to follow up with a GI doctor, or you need to follow up with this resource. You're going to leave and you're going to say, what did he say again? What am I supposed to do? And also, how the heck am I going to do that, right? I mean, I don't even know who to call or where to go. Like me as a physician, I don't even know oftentimes. And so I think we have an assumption that patients are going to take care of themselves. And if they don't, it's because they don't want to or they're lazy.
Yeah.
And the reality is it is a very complex, convoluted system. And so at 3 p.m., what you have there is typically a care manager or case manager, somebody that can say, I'm going to follow up with that patient. I got them on my list, or I'm going to go into the room and talk to them even better. And so you realize, gosh, care at that time is much different than care at 3 a.m., where you don't have that resource. You're a single coverage, meaning you're the only ER doc in the room. You're taking care of 30 different people at a time. And I walk in and I say, okay, yeah, you really need to follow up with that cardiologist. Make sure you call him. See you later. Got to go. Bye. You're fine. Get out of here. And by you're fine, I mean, I don't see an emergency right now, but you got a lot of stuff you got to do to take care of yourself, man. You got to call somebody, or you need somebody to call you. And we assume that's going to happen, and guess what? It doesn't.
And do you link them up to doctors? Were you linking them up to doctors, or are you saying find the cardiologist?
Yeah. So in the ER, we're saying find the cardiologist. I may even put a number. But here's the funny thing: the number I put may not even be covered by your insurance. Right. It may be a doctor that you shouldn't be seeing. It may be somebody that's 30 miles from your house and you don't have a car. There's so many factors that provide barriers to care, and you see that. And what's funny, there's an effect that I love. It's called the Dunning-Kruger effect or principle. And it's the thought that the less you know, the more confident you are about what you know. So listen.
That's Jen and I all day long.
Yes, that is, okay, that's a doctor too. It's like, I'm an expert. I'm an expert because I'm a doctor. So I know exactly what this person is going through, and I know that they shouldn't be here, and shame on them for coming to the ER. This is stupid. Why were they here? They had a stub toe. I can't tell you how many people come in for hangnails or for, a medication refill or something that you're like, why are you here, dude? Like, you just waited 3 hours in the ER. And you're like, wow, that person's really stupid, or that person is just lazy, or, go figure it out for yourself. And you realize, well, that is the Dunning-Kruger principle. I don't understand all the barriers that prevent that person from really being able to access care. And
because I can walk into an ER and expect care. I can't do that in a doctor's office.
You can't. And that's so Telescope Health was born out of, and we'll get back to that because we have been solving that problem in Jacksonville, which is cool. And we're now expanding that to multiple other municipalities and cities across the country. But what's really neat is, we were born out of that concept that, okay, you can't just provide a physician visit, okay? And so if you take, I'm not going to say the name of the companies, but if it's a company named
It rhymes
telemock,
with.
okay? Telemock or something like that, that everybody knows these telehealth companies out there,
Yeah.
right?
Yeah.
It's great if you have allergies or you need an antibiotic or you need something and you seen, boom, you get seen. But
Right.
how is that contributing to your actual care and how to get you back on track with a primary care doctor or deal with the issues that are preventing you from actually seeing, getting
Yeah.
preventative care, all the other issues. So we built a multidisciplinary care navigation team around the physician visits. And then we built an analytics company around and division around the whole company so that we could say, hey, instead of waiting for people to come to us, we're going to partner with a health system or an insurance company or an employer or a city and say, why don't you give us the data on all the people that use the ER? And we're going to positively or proactively outreach those people. And why don't you give us the people who have these top 5 disease conditions? We're going to risk stratify that population. Then we're going to outreach those people. And we're going to have a team that knows how to call and text and talk to people on a human level. We're going to get them seen immediately. And then we're going to funnel them back out to all the cool resources that already exist in the community that you should have known about,
Yeah.
but you didn't because you're busy and you're a person. You got a life. And so that's the full spectrum of the soup to nuts care. So you got to have the data, which the data awareness, and we call it awareness engagement care, but you have the awareness component. You got to know the data, you have to engage the people, and then you got to care for them.
At any point in the process, did you go, oh, I might be an asshole? For having those thoughts, I get when you're in
Yes.
times of stress and you're thinking, oh, this person is
Yeah.
so annoying. Why did they come in here? They're in the way. They're
Oh,
preventing
yeah.
me from doing my job and treating the people who really need the treatment.
Yeah.
But did you have that moment of self-reflection and go,
Oh, yeah.
I didn't know so much?
And Matt, that's the first time we've sworn on this
Yes,
podcast.
I know.
It's
I
really
I
not
heard
the
it,
last
yes,
one.
yeah.
I said the S word.
Yeah, yeah.
So
Good.
it's
Okay.
number 2.
Okay, good to know.
Going
All
for
right.
that.
Whew, okay. Now that the seal has been broken.
Yeah.
Yes. Yeah, so absolutely. I mean, and I pride myself on being like we all think we're super great, right? Let's pat ourselves on the back
Yeah.
a little bit.
Yeah.
Well, it hurts
I'm
when I
really
do it.
great.
Oh,
And people
geez.
like me, gosh darn it, people like me.
It's
Yeah.
an SNL
Yeah,
episode,
yes. So
Stuart.
yeah, honestly, my asshole tendencies are, as a doc, were just to be like, I'm just going to discharge that person. I talked to him before. I've got too many things to do.
Yeah.
And I'm going to put the discharge order in. I'm going to let the nurse tell them what to do, instead of going back in and really sitting with them because, and I can blame it and shift the focus on the fact that I had too many patients to see, too many things to juggle. But
But that's true.
It is true.
true,
Yeah.
yeah.
Yeah. There's truth to all of it. And then there's other people who, are frustrated. This is the other piece of the Dunning-Kruger is when somebody comes in and they're defensive automatically and they're like, you're not helping me. I'm frustrated. This has been horrible service. But like those things, a lot of those things are really true. And if you don't listen
Yeah.
to the patient, then, and you just are immediately defensive, like, I'm a healthcare provider. How dare you talk to me that way? Well, like, let's listen to them. Like,
Yeah.
There's a reason why they're saying that. And granted, there are some people that
I was going
really
to say some people.
yeah,
just,
exactly.
they
Yeah,
can
yeah.
get
No, there are
PO'd
some
at a very
people, and
tiny
we just
thing.
kick. Yeah, absolutely. But a large percentage of people, it's like they're just genuinely frustrated. It's
Yeah.
like when you're on a call line, with somebody, and you wait for 45 minutes to that elevator music, probably the same elevator music you guys are using for your podcast.
Nonsense.
Yeah,
It's beautiful. When you hear it,
The tone.
you will the only thought you'll have is it needs xylophone.
yeah. I'm gonna. That's what I'm bringing to this. Okay.
Right.
Yeah.
I have, I wouldn't say I have, my parents actually have a very personal experience with this. My father, I watched him suffer for almost an entire year
Yeah.
without the actual diagnosis.
Yeah.
And come to find out he had cancer.
Wow.
And so we wonder, okay, how many bones could have been prevented from
Yeah.
breaking
Yeah.
if the doctors
wow.
would have listened every
Yeah.
time they were in the ER for the different things that were happening?
Yeah.
Because it was that individual, you came in for this, I'm going to look at this
Yeah.
and maybe this only,
Yep.
and then we're going to get you out of here.
Yeah.
And then all said and done, almost a year later, he gets a blood cancer
Yeah.
diagnosis.
Wow.
And so my parents, they're in their 70s at this point.
Yeah.
They don't have this experience. They've been really, really healthy.
Yeah.
So they don't know, and they quickly learned you have to be your own advocate,
Yeah.
or the family member needs to be the patient advocate because of everything
Yeah.
that you're saying, and people don't know this. So
Yep.
you started Telescope, and you wanted to, long story short, remove the barriers to healthcare. And then you also wanted to ensure that the patients got the follow-up that they needed. How do you ensure that with Telescope?
Yeah, gosh. It's hard because follow-up can mean a lot of different things, right? So it can be as simple as a primary care appointment. It can be food insecurities, transportation. It can be enrolling in Medicaid, for example. It just depends on the population. And so I think that's where partnerships are so key. So we pride ourselves on not trying to solve everything internally, because to be really successful, and I'll give, so a program we do in Jacksonville is called Healthlink Jax, and this is really the first of its kind in the country. It's a super cool program, and it illustrates the full DNA of Telescope, but the goal was there was over 100,000 uninsured people in the city, right? And they use the ER primarily for care because they can't access care anywhere else.
Right.
And so how do you solve that and reduce, that unnecessary ER utilization?
So, quick question.
Yeah.
The reason why they go to the ER is because ERs are required to see you legally.
Yeah, absolutely.
But a doctor's office is not required to see you.
Yeah, it's not required. And, I'll say this too. There are we work with all the safety net clinics in the city, meaning nonprofits that specialize in providing primary care and behavioral health and all sorts of services to people who have no money or some money or partially insured. So Soulsbacker, Agape, Volunteers in Medicine, Jax Care Connect. These are all organizations that already exist. So there are resources out there. But changing behavior, like everybody knows, 911, I can call 911 if I have an emergency. And when you feel like you have an emergency, you get animal brain, and then you just do the first thing you think of, call 911, go to the ER. And so we even have resources in the ER too to kind of funnel people out, but it's how do you change that behavior? But once they hit the ER, yes, there's a law called EMTALA. It's basically the requirement that anybody who comes to the ER has to be evaluated, has the right to be evaluated. So, the goal is how do we change this behavior, provide a resource that's a catch-all. And so, the city had a committee, they put out an RFP, and Telescope's a Jacksonville-born company. We're really built for this. And so we partner with the city to build this program, and we provide that kind of soup to nuts program, basically call a hotline. And it's funny, like from a public perspective, it's very simple. You have a phone number, you call the phone number, you immediately talk with a nursing-led team, listens to your problems, and then if you need to see a physician, they send you a text link to your phone. Click on it, you see the doctor immediately, and then the team follows up and helps you with the next steps of care. What's really happening, super simple, right? All you got to do is call the phone number, 925-CARE. That's it. What's really happening is that we are integrated in with all the health systems, and 3 of the health systems right now are giving us daily referral feeds. So if you're an uninsured patient, you go to the ER, they're going to send that data, that patient to us. We outreach that patient. We also outreach patients who are known high-risk patients or, uninsured.
So this is after the health system has seen the patient, they send you.
Yeah.
What's their purpose? Is it so that they don't come back?
Yeah, absolutely.
Yeah,
So ER bounce back is a huge problem.
Okay.
And in fact, hospitalization and length of time, what's called length of stay, but the amount of time you're in the hospital is really often determined by how many resources, what's your safety net when you leave? Like if you live by yourself, you don't have any family to take care of you, you don't have insurance, and you were admitted for an infection that requires antibiotics, and you're not trusted to actually fill that or take that, then you may stay in the ER or in the hospital 12 hours, 24 hours longer than somebody who does have all these resources and says, "Get me out of here," So we do this proactive component, and then on the other side of it is you have to integrate with all these community resources. So Feeding Florida, Soulsbacker, all the safety net clinics, Department of Health, Salvation Army, American Heart Association, like all these organizations are doing things to help people. And so we've had to go in and integrate. Some of them were covering after hours coverage. Some of them were sharing data. Some of them it's just awareness campaigns, but you got to work with everybody. It takes collaboration.
How do you accomplish that?
Yeah, team.
That's a lot to get everybody on
It
the
is.
same page and moving in the same direction, but it's amazing.
Yeah.
How?
Yeah.
Is it free to the organizations?
So
like the Soulsbackers?
Yeah, so it is. And the city funds this program.
Right.
And so
Okay.
I'll give some of the data this far. So we really have had this program in effect for 7 months. So October is when we had an official launch, and Mayor Deegan made an announcement. And we've had over 4,000 calls, and we've saved the city over $4 million in avoided ER costs.
Amazing.
So, that's what's so cool about the power of this program. And a lot of those are people finally realizing we're a resource and coming to us. But if you build it, they will not come. You have to like go out and
right.
Unless
I knew that movie was full of.
Yes, exactly. But it is true. You expect people to be like free healthcare. If I'm uninsured and I live in Duval County, of course I'm going to use that. But the reality is they don't know about it, or the animal brain takes over and they just go to the ER. So that's where the proactive outreach comes into play.
But you said it saved the city $4 million. So does that mean that the health systems send a bill to the city if they're see someone who's not covered?
So the city is subsidizing care right now. Taxpayer dollars go towards the city providing care for the uninsured, and a lot of that goes to UF Health. But in essence, EMS services, 911 services, ER utilization, healthcare costs, economic burdens.
Do you know what that number is?
What's that?
Do you know what the number is by chance?
The number of
what percent of our budget actually goes to this?
I don't know the percent of the budget that's in this full city budget that goes to healthcare, but it's a substantial amount of the city's budget goes to healthcare initiatives.
Okay.
And so there's another place I was going to go with that. I can't remember, but
Well, neither can I.
Oh, I know what it was.
Because you have the interrupting machine.
No, it's good. Yeah,
I can feel your annoyance.
Yeah, no. The only other stat I would say is in Duval County, we can track the average charge of an ER visit. So if you're uninsured, you go to the ER, you're going to leave and you're going to get a bill a month later. And if you're self-pay, you'll get that bill, and it may even go to collections. Now, granted, the health systems may say this person has economic hardship, we're going to forgive or reduce this, but as a human being, you're going to go home and you will get a bill, for those services. And the average cost of an ER visit is $4,800 if you're self-pay and you're discharged. Not if you're admitted, but if you're discharged. So you go in, you're taken care of. And I don't want to confuse this with saying, like, don't go to the ER. I mean, there's a reason why I have a profession as an ER physician. There is a definite need. And sometimes people come and say, I'm having a weird feeling or sensation. Well, that's actually a stroke or a heart attack, and you needed to be there. So, but it's identifying the people that don't, which is so crucial. So
bringing people together, bringing all the partners together.
Yeah.
We're figuring that's where.
Collaboration. So, I gave a TED talk on this last year, actually. And there's a great public health study that looks at why are certain public health programs successful and why are others not.
Yeah.
And when they polled the ones that were like really successful, like the outcomes change, or they had real data to show like, okay, we've done something here. And it was collaboration. Like they all resounding said, okay, we didn't come in to do something singularly. We involved all the players in the community. And it's hard. Like when you're a for-profit company, you want to show your value, or even when you're nonprofit, you want to protect your value proposition so that you protect your funding or your revenue or whatever. So there's a tendency as human beings to say, I can do all this. I'm going to do all this. I'm in charge. And we came in and we realized, well, we're the glue. Like we can get all the health systems to get behind this. We can get all the safety net clinics to get behind this. We can get the city to get behind this. And then everybody wins. And so you got to have this full, hub and spoke model where you have everybody involved. So
are you missing anything now? Have you guys identified after you've been up and running?
Yeah.
Okay.
So I'll say this. So from a healthcare organization perspective, I don't think we are. We have literally all the health systems are either to some capacity saying, if you're uninsured, Healthlink Jax is out there for you. And the 3 of the health systems are they've engaged in real-time data referrals with us. And we're going to do some really cool stuff in the next coming months where we're, tapping into health information exchange. So when you as an uninsured person hit the ER, like we know in real time, and we can call you and be like,
that's cool.
Oh, you're in the ER, like, what's going on? But
whoa, hold on.
You got to staff a lot of people to support
I have to interrupt on this one. So Jen's uninsured, for example.
Yeah.
You're not, but she goes to the ER.
Yeah.
And you will call them in real time?
Yeah, so we can, absolutely. So that's a cool thing. So, and this isn't a novel concept. This is actually, there's a sector. Well, so in the healthcare sphere, there's value-based care, which is the government basically says, listen, we want organizations to take better care of their patients instead of paying them whenever they're seen. So like you could come to me 1,000 times to the ER and I can bill and make money every one of those times. Is that incentivizing you to do the right thing?
Right.
No. Is it incentivizing me to help you do the right thing? No, I'm getting paid for you just to show up. So come on in.
Yeah.
But alternatively, if the government says, we're going to give you X number of dollars to take care of this patient, It's your job to do it effectively. And if you do a better job, you get to keep the difference, or we'll even reward you or bonus you with more. So Kaiser Permanente is a system that does this out of the West Coast. And their model is fully built on this capitated model. It's not, it's not about how many times somebody comes in. It's fully built on, we just got to do whatever's innovative enough to take care of this person effectively. And the cost is on us. It's just like running a business, right? So does it
look at health outcomes? So they came in
big time
as A.
Yep.
They need to leave as B.
Yep. Yeah. How long? How often did they go to the ER? How often are they hospitalized? How well do they manage their diabetes, their blood pressure? All that stuff.
Okay.
So we're actually, the public health side of the company is taking what we really do, which is that value-based care side, and working with those organizations and just applying it to public health. So that health information exchange, that ping that I told you about, that's one example that a lot of organizations do. They follow these health information exchanges and follow patients and populations of patients, but nobody's applying it to the uninsured. So, when people now, we have a big book of business. We've had, over 4,000 people that have engaged with us in a short period of time. And every month we have a 20% growth. And so...
I was just going to ask, how do you staff this?
Yeah.
How do you ensure you always have the right amount of doctors on call?
Gosh, man. So the doctors, it's funny. A lot of those calls are really, we have a nurse team. So some of those calls are like, I need diabetic needles. And Paul, our chief population health officer, uses this story a lot, where somebody called for needing diabetic needles, and they were going to go. The only place they could find them was $60, and we found them a free resource. So it's simple stuff that doesn't require a physician. In fact, I wouldn't know where to find those. We have a team of case managers and nurses that find that stuff out, and it's usually because Soulsbacker or one of the local resources has them. It's just connecting them with the right resource. So we don't need to do all the things that are already out there. We just need to be the connector. And then the physician pool, we've got a great pool of ER physicians that love to hop on and pick up patients, and it's very rewarding for them.
Okay, so we were talking about this too. Is this their full-time job? Just being on the phone to take patients, and what takes you out of the ER and being willing to, you don't have that same energy on the phone as you do in the ER.
It's crazy. So the ER is an interesting place. I mean, most of docs that I know that have been ER docs, they love the variety, they love the excitement, they love to solve problems, but it is prone to burnout, and there's a high burnout rate. And in any field of medicine in general, just because the documentation, the billing, the fact that the system is broken inherently, so patients are just more upset. And so they're looking for ways to give back and for it to be rewarding. So we have a lot of docs that still do some ER work, but then also do this on the side. But then there's a big cohort of physicians that are moving out of in-person and doing only virtual care. And so for example, I have licenses in all 50 states so that I can take care of people virtually anywhere. Although my role is really, on building the business, but we have a number of doctors that they've made it their career to have all 50 state licenses. Some of them even live in Hawaii. They're actually docs that we found. They live in Hawaii and they take care of our...
Is there a net loss with that, where a loss of real world interaction with a patient?
That's a great question. And
no, because I'm dying to know, is my annual physical going to become virtual at some point?
That is a big part. Yes. In fact,
yes.
You're going to draw your own blood.
We have
Send it
payer
in.
partnerships. So we work with insurance companies, and one of our biggest partners in the Midwest is a Blue Cross Blue Shield entity, and they have a large number of patients that they say, we just can't get these people to engage with us, and they're in rural Nebraska. So what do we do? And so that person's not going to drive 4 hours to see, a doctor. No. It doesn't make sense. So we can do an annual wellness visit for that person and then we can coordinate, for even EMTs or people to go to their house to check their blood work. But, or you can say, there's a resource with, that you can go to as well and get those things done. So a lot can be done virtually, which is cool.
I have so many questions. Really, they're selfish. I would like to know, and then we'll get back on track. I would like to know, why do doctors, and maybe this is
I'm on the edge of my seat
thing, when you go and you schedule your physical, they have you see the doctor first, and then they order your blood to be done. WTF.
Such a good question.
I
Make it make
want
sense.
to
Matt.
have the doctor tell me, what am I doing wrong? Why does, the different things in my blood look the way that they do?
Yeah.
So I harassed my doctor's office, and I was like, you will order the blood work first, and
Yeah.
then I will see the doctor.
Yes.
Because he can tap my knees and look up my nose
Yeah.
all day long. That's
Yeah.
not going to tell you if I'm dying.
Yeah.
So they did that, and I had a really nice, intelligent conversation, and he educated me
Yeah.
that I worry way too much about high cholesterol that is like not really that high, but still I've eliminated eggs for the most part. But I wouldn't have that engagement if it is in the reverse order. And I think you told me you called for your and they were like, no, dude.
Yeah, you got to come in,
You
get your
see
blood
the
work,
doctor,
come back.
And then,
Yeah.
Yeah, and it's funny. There's reasons because a large part of it, not everybody gets the same blood work or should get the same blood work done, and so there should be some information gathering. Now, wasting somebody's time. In fact, we have stories all the time where like somebody says, "I had to take my mom to her cardiology follow-up appointment," and at that appointment, the only thing they did was say, "Are you short of breath? Let me see your ankles. Do you have any questions? You look good. See you later." And to get to that appointment, they had to go pick that person's mother up at the nursing home. They had to drive her 45 minutes. They had to find a way to get her. She's, had difficulty walking, get her up, to the 16th floor, bring her back down, bring her back to the nursing home. That's ridiculous.
It's a
right?
to-do,
So,
yeah.
But if they don't do that, there's a potential for liability there, maybe?
Well, it's not even, so the follow-up appointment's important, but I think it's just changing behavior patterns and how you facilitate that. And so certainly virtual care and telemedicine has changed. And the good news is like a lot of most health systems and groups are navigating, moving towards that, to use it when they can. And certainly, insurance companies, physician groups, health systems are looking for ways to make this easier. I mean, it is happening, but doing it at scale takes time. And
should it? I want to just challenge the premise. Should it happen at scale? Is there a world where there's too many people in the kitchen, so to speak, trying to make this efficient, and maybe there just needs to be less people? Maybe it doesn't need to happen at scale.
Yeah.
Maybe,
how are you going to accomplich that?
I don't know, but I mean, I'm just wondering.
Scratching my head.
Yeah,
I
yeah.
don't
Well,
totally.
Find a volcano and,
Well, I'm wondering, I can't remember what I was listening to, but the implication was that a doctor has to be part of a larger network just to handle the administrative work.
Oh, definitely. Yeah.
And so whatever the bureaucracy is that's sort of mandating all this stuff gets done, maybe just eliminating that bureaucracy so that maybe a doctor who wants to just see 30 patients can just do that. But there's just no business model that supports that. So it has to be this mass scaled operation. And we haven't created the model or is there a world where you can have a small town doctor and that person is not living paycheck to paycheck?
Yeah. Well, so certainly concierge medicine is something that, and it's all about how much money do you want to spend,
Right.
So,
Well,
and that model is definitely different. I will say there are certain things that you want to preserve where you need a doctor and preserve the doctor relationship, but there are a lot of things, bureaucratic things that physicians do, documentation, information gathering that could be done ahead of time that they don't need to do. There's a lot of guidance as well, and that can be provided outside of that, doctor relationship, and preserve the doctor for the things that they're really specially trained for. In the next 10 years, some of the numbers, like AMA says, we're going to have $120,000 physician shortage in this country.
Wow.
$120,000
Why?
shortage. Because we have too many people.
Because I didn't listen to my mom.
We have too many people, and we have not enough physicians. I mean, it's quite, and not enough people are going into medicine.
I was going to say, are people just not picking that as a
it's
career
rigorous.
anymore?
It's hard, right?
It is, and there's just a growing need, and we have a higher degree of population that's going to be a Medicare age population. We're aging, and so there's a number of factors that come into play, and you take out a lot of debt and a long road to become a physician. So we have to find other ways to augment, and so there's a lot of neat stuff in the AI sphere. So what Telescope's doing, for example, is kind of to address this capacity problem. It's a capacity problem, right? So we have a physician group partner that sees about 30,000 people a month. So, and that's a primary care group. So maybe the primary care group that you are trying to get an appointment with. And they're using us to ensure that, okay, they realize when they looked at their own data, we assumed all the people who were going to the ER, because we have to follow and make sure our patients aren't going to the ER when they should be seeing us, or how we fix some of this problem. We assume it was going to happen at 7 p.m. or 3 a.m. or after hours. It wasn't. It's 10 a.m. That's the time that they see their patients going to the ER, right in the middle of the business day. And it's a capacity issue. If you can't call and get an immediate answer, you're going to go. You're just going to go find the only thing you can do. And so everybody is faced with this capacity problem. It is not unique to any geographical location. Rural is, and so if you're in an urban center where there's a lot of physicians and hospitals, like you're still going to deal with it. Imagine if you're in, Hilliard, or if you're in some rural area in the Midwest, so big problem. So we have to find, so Telescope takes that data from those patients that haven't been engaged or have gone to the ER, or even before, patients in the last year who haven't been able to get in. We outreach those patients. We do the virtual care. Then we funnel them back into the brick and mortar, back to that primary care doctor and ensure they actually go and get the care they need for ongoing care, I guess.
Excellent. Was med school really hard?
Yeah. So, okay. So I am not a type A person. And so, in some ways, definitely, I think all doctors have like type A tendencies, but I just I like people, and there are some real type A people in med school, freaking out. And so I think the sheer amount of studying and time in the library and everything, that was not for me. But you just exposed to all these new things you didn't even know existed. It's just crazy.
But what's the personality of someone who goes into, I want to be an ER doctor?
That's something special.
Because that's not the dude from the Big Lebowski.
Really incredibly handsome. Typically. Yeah. No,
clearly, that's point one. Obviously.
I think it's people that just like to have their hands in a bunch of different stuff all at once. I mean, it's just, you got to be comfortable with
maybe
saying,
a little bit of ADHD.
Yeah. Oh, yes. Yeah. My wife will listen to this and she'll say, yep, absolutely. But yeah, I mean, absolutely. You got to be able to, and you get excitement off of that, like bouncing from one thing to the other.
I mean, that's my cousin. Yeah. She specifically went into nursing and knew she was meant for the ER.
Yep.
She cannot just do one thing at a time. Yeah. She's got your kind of energy and she's just boom, 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 boom. And obviously so attractive too.
Yeah.
Shout out to my cousin
it is a prerequisite, really.
Yeah. That's why I couldn't become a doctor.
Yeah. They weeded you out. You sat in front of the board, ready to be certified, and they were like,
sorry, man, I'm not going to make the cut.
Too much shine.
Yeah, exactly.
I love it. That's funny.
So you mentioned there's a physician shortage.
Yep.
Is there anything in the works to kind of streamline becoming a doctor, or is it the rigor? Is the rigor?
Yeah, it's funny. So
kind
Florida,
of terrifying to think about it.
Yeah,
though.
Florida is doing things to allow medical students or medical students who've graduated but haven't done a residency to see patients. But you're kind of putting a Band-Aid on with that problem. If you think about it, and then also foreign medical grads to come in and have less barriers to care. I think that's certainly one avenue. Is we need more doctors, right?
Yeah.
And we need to make it easier for people across, different areas of life to become a doctor, because what makes a good orthopedic surgeon or a good oncologist does not make a good ER physician or family practitioner, right? We need to incentivize more people to be family practitioners, because we do have a significant problem with prevention in this country.
Yeah.
And so much of, the care, the downstream effects we see is avoidable. And so we need to find ways to do that. But I think the technology, the way that we provide care is super exciting too. And so, some of it's on, our focus is on the risk stratification and outreach engagement side, but there's a lot of cool companies out there. Like a Bridge is a Gen AI company that's in just huge. I mean, multi-billion-dollar valuation, still private, started by a cardiologist, and they do ambient AI technology. So, if I'm interviewing you as a doctor, it's making the chart for me. It's making the recommendations for lab orders. It's, so much of that stuff can be automated, and we're seeing it. It's just not, that stuff needs to get to scale, and it will. So that's
the trust factor with doctors. Like, how do you keep bringing technology to the hands of the people who need the support, right? To streamline things. But is there an issue with the trust and therefore that's slowing down the adoption of technology in healthcare?
Yeah, I think we're going to reach a point where it's widely enough accepted. Telehealth was a perfect example of this. Like before the pandemic, I remember meeting with a certain insurance company in town that's quite big, and they're like, we just don't see, telehealth expanding very much, and so
That's interesting.
and this was, and then the pandemic hit, and it's just like everybody realized that we were kind of forced to do this, and
Yep.
now,
and how convenient.
Yeah,
And
yeah.
how people prefer that.
And they prefer it.
Yeah.
Yeah, absolutely. And there's definitely times where you need, in-person care. A lot of times you do, but there's so many things you can do virtually. So,
Can I jump back to your business model?
yeah.
Is it strictly, are you making agreements with cities and
No,
counties? Can Jen and I use your service?
yeah,
So there is a retail component to this.
There's a direct-to-consumer side, and so you can go use Telescope Health, and if you have insurance, we can bill your insurance, and if you want to self-pay, you can do that. I think our self-pay price for a visit plus all the wraparound care navigation is $69. So
That's affordable.
So I can expect wraparound care if I use your service?
Yeah, absolutely. So you use us, and then we'll take care of you, and you say, well, I really needed to, just want to make sure I need to see a GI doctor for a colonoscopy. Can you help me? And then our nurse navigator will call you and say, can you run me through what insurance you have? Let's find who's in network for you and then help you follow up with that. So it really is like a next level.
Yeah, because that doesn't happen with Telemock.
Yeah, Telemock does not do that. No.
Does not happen.
And so, scaling that requires us to have, a team, a care management team, a care navigation team essentially, and the physicians. And we added on behavioral health this year, so we have psychiatry and therapy as well. So the business model is certainly municipalities, public health programs are publicly funded. And that's one avenue. The other is, employers per member per month. So we do a lot of employee benefit work. And then we work with insurance companies, and that's usually a mixture, of, them funding plus, the what we call fee for service. You get paid when you see a patient. So
Where's Telescope Health in 10 years?
I think it's funny. So this year we have those three sectors, and I think we're really going to dive into the AI data risk stratification modeling aspect and automated engagement. That is an area that's really exciting for me because our partners all have big data, and it surprises me how little they're doing with it, And so I see us really automating that, being deeply embedded in with a lot of cities, municipalities, and EMS providers. So, we have a partner, AmeriPro, who is an EMS provider in 14 states. They do a lot of city contract work, and we're actually embedded in when somebody calls 911, if they are deemed by 911 dispatch team say, maybe this doesn't need an ambulance sent to their house right now. Let's funnel it to Telescope. Telescope then sees that patient, and so we have several cities we're in the middle of contracting with for
That's
that.
That's a great
too.
idea.
That's awesome.
Yeah, I think big level though really further.
Can you tell me why they send fire trucks?
Yeah,
that's such an interesting thing to me.
Yeah. I mean that's an interesting question, and I mean that's just the way that fire and rescue EMS has been designed, and so. But you talk about cost savings, reducing the need for that, and you got to do it both ways. You have to have public health facing so people don't call 911.
Right.
And then when they do call 911, you have to be able to funnel those people out to the right resource,
Right,
which,
right.
So we kind of cover all sides of that. But yeah, I think I think we'll have a lot of municipalities that we're partnering with and replicating Healthlink Jax in. And I love the public health side of that. And I think that we will have a lot of employer insurance company work that, we're going to continue to grow and have cool data, data query capabilities, Gen AI engagement capabilities, where we're outreaching people who need the care. So
That's great.
That's awesome. I just had a question, and then I looked at you and it went away.
it happens. Yeah.
Thank you.
Just sucked the intelligence right out of you, didn't it? Yeah.
Well, what do you think? Real or ridiculous?
Yeah, we're going to play this game
let's
already.
do it.
So,
Okay. Yeah, let's do it.
Welcome to Real or Ridiculous.
That's good.
Yeah. So
the premise here is actually Arash always wants to be the one interviewed, so we're going to give him the opportunity to actually be the game show attendee, not the game show.
I just didn't get the attention I needed as a child.
I hope your parents aren't watching this.
They're not. Okay. That's my point.
So you are going to tell us a story from your days in the ER.
Yeah.
And we have to guess whether or not it was a real story.
Okay.
Or if you're just being ridiculous.
Okay.
And obviously we're highly competitive with one another.
Yeah.
So there is
It's not a competition for me.
There is a clear winner. Already.
It's you, Jen.
All right. It was a slow Friday night in the trauma center.
That's perfect.
In Tucson, Arizona. And we get a call saying, we're bringing in a patient. This patient has been struck by an object that is protruding out of their eye socket after a lover's quarrel. Call neurosurgery. So bring this patient in, and in through the double doors, bust open, and this woman is screaming, kicking, saying, I'm going to kill him. I'm going to kill him. I'm going to kill him. I can't believe this. And out of her eye socket is poking. What do you guys think it is? I'm just going to ask you first because I don't, yeah.
I mean, I'm thinking something totally inappropriate. So,
okay. Yes. Yeah. Okay. We go down that
Those
route.
things aren't
Yeah.
sharp enough.
Yeah. Yeah.
I just figured it's a dull impact.
Okay, we're thinking the same thing.
Okay. I'll give you a few options.
Okay.
Out of her eye socket was poking a fork, was poking a chopstick, or was poking a toothbrush.
Toothbrush.
It was a toothbrush.
Why did we know it was toothbrush?
Because I bet you they were fighting
As they go.
over the bathroom and the mess that the husband had made, and he finally just got sick of it.
Did we presume husband?
Well.
So toothbrush.
Yeah. It was a toothbrush.
Oh, that's terrible. Well, we didn't do real.
You didn't do
imaging.
real. Yeah. Sorry.
Well, that was clearly real.
Yes. Yeah.
It's very believable.
Okay. But it was actually the Brussels side that went in first.
Oh, the germ.
Real or ridiculous?
Okay, well,
That's, I mean, it's both.
it's
I'm
really
asking.
and
You think it
ridiculous.
was? Yeah.
I'm gonna go real.
Wait. Oh,
The bristles or the plastic end.
okay, let me just think. I'm in the heat of the moment. It's 50-50. I'm going to say it wasn't the bristles.
You were looking at the mechanics of it. I like
Yeah.
that. Like, how do you brush your teeth? And
I was thinking that too. But what happens if you just grab for your
yeah.
like you're grabbing a knife?
Why don't you guys try it later? You know? Yeah.
next
So it
podcast,
was.
both
It
of
actually
us have
was. It
things.
was the bristle side. It was the coolest
Wow.
CAT scan I've seen because it actually. I mean, this is not cool. This person lost their eyeball, but
I was gonna say must have lost the eye.
yeah. But you know they just hit it in the right spot, just to go right behind the eye. You know,
Oh my gosh.
and there was bristle side in, and so you could see all the little toothbrush bristles on the CAT scan. You know,
wow.
behind the eyeball. So yeah.
Did he go to jail?
I'm assuming yes.
I'm gonna say that.
Yeah.
Don't know.
Can't
I didn't
believe-
follow. I didn't have Telescope Health to follow up on
Yeah.
that one at the time. So
Well, that's actually a good point. Do you have to call the police at certain points if someone calls and there's an issue?
yeah.
Part of your
Is that part of the
absolutely.
requirement,
Yeah,
right?
yeah. So absolutely. So especially for when children are involved,
Right.
or when somebody's obviously a threat to themselves. You
Yeah.
make that decision. So yeah, lots of times.
Okay.
All right, next one.
Mm-hmm. Okay. All right. Let's see. Okay. So get a child who came in to the ER, and this child had an earache for quite a while. We look at, we
What's
get
your
a lot
first
of
thought,
kids.
though? What's your first thought? Because my first thought is insect.
Yep.
Yep,
And never
okay.
sleeping again
Okay.
without earmuffs on.
Right. Okay, go ahead.
So we get a lot of kids in who come in with, they shove things in their ears, okay, right? And they get infections, or they have perforated eardrum, just from getting an infection, and the fluid builds up and everything. So we look in there, and obviously right off the bat, yes, there is a small insect in there, and it's squirming around, and so we flush. This is very satisfying, okay, to do. It is one of my favorite things to do. The nurses love to do this. They never want to let you do this, but you flush, the ear until the insect comes out. So it's like a little winged, it didn't look like a cockroach. A cockroach but it's a little winged. And so we look back, and it's like, oh yeah, eardrum is perforated. And we look back in there and see a bunch of other little things in there too. And it was little eggs that had been laid in there.
Oh no.
I really want this to be ridiculous, but it's I mean, I'm pretty sure I've seen this on one of those like docudrama ER shows. I'm going real.
I think it's real up until the point of the eggs.
Okay, yeah, you're right. That last part was ridiculous. that does happen. I'm sure it does happen. It just didn't happen to me. Listen, here's the other thing. We love to steal stories, okay? I got lots of stories that I've said are my own, but I've stolen. But the toothbrush was mine. That was my story.
That was a real story.
And lots of insects in the ear. But
So then doctors really do like to talk about
That's
the
why
crazy
that's why you
stuff.
become an ER doctor for the
Yeah, of
stories.
course. Yeah.
Good looks and good stories.
Yeah, yeah. That's my book title, actually. It's really funny, yeah.
All right, you got one more in you? Because so far we've had both real.
Gosh, let's see.
Let's see if you can trip us up.
I know. I need to think of a good one. Okay. All right. So I did my residency in University of Arizona. So Tucson, 45 miles from the border. And frequently we would have people who would come in for being mules. Okay. Drug mules. All right.
Thank you for clarifying.
Yeah. They're not real mules. Okay. Let me break it down. I know you're not a physician.
Yeah,
Let me break this down for you. Okay. So drug mules, right? And so you never knew when somebody came in, if they looked a little sketchy, you're like, they got belly pain, something's going on here.
Yeah.
Okay. So we'd always say, like, what do you think? How many, bags do you think are in there or whatever? And so the most that I ever had was a lady who came in. She was a drug mule. We did the x-ray and we counted. The radiology, love counting this, but 68 bags were impacted all throughout her entire colon.
Oh my God. Ridiculous. There were 67.
It's hard to not say real.
Yeah, it was real. Yeah.
I was really hoping it wasn't. That's so terrible.
Yeah, that was a cool x-ray too. Those things get burned into your memory, like
Yeah, how could
seeing
it
that.
not?
Have you ever treated someone where the bag broke?
Oh, yeah.
Oh, I was going to say that.
absolutely. Yeah.
Okay.
Usually.
Yep. Yeah, I have people, running around naked all the time. It's like bath salts. There's certain areas, you guys know what bath salts are. Not the magnesium, but definitely cause crazy.
I actually don't know what it is.
Yeah.
I know that it's some sort of drug, but what is it?
Yeah. So I mean, it's.
Wait, we're not talking about the things that you make your bath smell good and it's bubbly?
It's
I'm slightly naive.
It can. The honest answer is it can vary. So like it can be a number of different. Chemicals that are a form of methamphetamine, for example, or can cause the same effect.
So what we were talking about.
Yeah, but the reality is they can cause really messed up trips and hallucinations and aggressive, crazy behavior. So there was when I was like 8 or 9 years ago, there was a person who had and this was all over the news, but they bit somebody's face or ate somebody's face off, while they were high in bath salts, under a bridge somewhere. That's
Florida.
Yeah, that was Florida. Yeah.
He was your patient?
No, that was not my patient.
Okay.
But that's, and those are real. That's like really happened. But we did have a patient. I had a guy who was running around naked. Police were chasing him for hours, and he had tried to jump over a barbed wire fence, and so he came in, after being naked and jumping over a barbed wire fence and was totally high out of his mind.
Wow.
So
what's it like talking to that person when they're down, when the drugs have worn off? Are they?
Yeah,
I don't
really
even.
pleasant.
Or do they even know? I mean, do they know what happens? Are they aware?
Yeah. No.
So they're just completely gone.
Yeah. No, I mean, just out of it. Yeah. So
that's nuts.
Yeah.
That's crazy. Do you still practice in the ER at all, or are you totally
so occasionally? But the last 6 months has been really. Telescope's a national company now, has grown so much, and so my focus has really been on that, and especially with the public health program. So I do miss that. All my friends kind of give me crap about can you even do this stuff anymore? So
yeah, if you don't use it, you lose it. Does that
I did it for 14 years. I think I could probably intubate somebody or put a line in or do all the fun stuff pretty easily. It's more the things like the complex cases where you don't want to forget nuances of care and the latest and some of that stuff. And I think most definitely go back right now. But I see over time, a couple of years go by and so
you know how to build an API, but
yes, exactly. Yeah.
Really
Weird kind of transition of skills, I guess. But no, but it's fun. I mean, being a physician leader and is really, it's like, this is my calling, doing this and building this company has been so fun. I get to meet people like you guys, I mean, it's just cool. You realize you really were so stupid in so many ways. And you
is he talking about us?
Yeah. I'm saying, yeah. Right, guys? You realize that?
Yes. We do.
Every day.
The moment we sat down with you, Matt, we were like, we are too stupid for this.
Exactly. Yeah.
Why Jacksonville? The telescope.
So I moved to Jacksonville. It's funny, when I moved here, I didn't really know much about the city, and I didn't think I'd be here long, and I fell in love with it. I mean, it's such a great place. I mean, I can tell you this: if I would have gone to San Diego or Seattle, or the other two places I was going to go are San Diego or Seattle, and would not have had this opportunity. This is such a talk about collaboration. Like, just you guys are a perfect example.
Yeah.
Like, Matt Burseth, has become a good friend, and I mean, it's just awesome to meet all these different sectors of business, technology, healthcare, and to build something. I mean, it's just what I've been able to do. So, I mean, it's awesome.
People in Jacksonville, especially the companies here that are based here, care about building each other up.
Yes.
I've never seen
it's crazy,
that
right?
before.
Yeah.
But also, I mean, the last city I lived in was New York City, so that's not going to happen there.
Yes.
So when you come from that big city mentality, but even I grew up in upstate New York, very, very small town.
Yeah.
And it didn't ever feel like the community was coming together to do great things.
Yeah.
But Jacksonville is something quite
special.
special.
It is really special, yeah. And, it's cool too. We're very much in the middle of, like, we're a city service, right? And a city contractor. So we work in a bipartisan way, and there's a lot of divide in this city, just like there is everywhere in the country. But I think what we've built, like, everybody can get behind, and it's, I'll tell you, like, doing this public health program has allowed us to work with technology companies, like we are, our development is here. We get to work with UNF, so I'm on the advisory board for UNF, which is super cool. And we're doing this partnership with MedNexus, and then you build all the health system relationships. And even though they're competing with each other, they get behind this kind of a program. And so you just get exposed to, like, all these different groups of people, and each one has a different reason why they're like, wow, we want to help or participate. So yeah, it's awesome.
What advice do you have for, let's go with two different types of folks right now? One, the people who went into medicine and they're getting frustrated.
Yeah.
They might be getting burnt out and they want to do more good in the world.
Yeah.
What advice do you have, thinking of your path and where you are right now? How do they do this?
Yeah. Well, first, don't brush your teeth next to your significant other when you're in an argument would be the first thing I would say.
That's a new rule for me.
Good advice.
No, so I was not afraid to look outside the box. I think that there's kind of two kinds of people. One who it's not necessarily even a victim mentality, but it's the system. I'm just going to continue to complain about this, and I'm going to trudge along, and you will be stuck, if you do that. And so I kind of had to step out and say, I'm going to sacrifice a little bit of what I thought my career choice or path was going to be to create something different and learn from people. And so certainly, again, I'm going to harp back on this. Like, if you just assume that there's a lot you don't know and you seek out advice and knowledge from people in different areas, you will learn so much and opportunities will present themselves. So for young physicians or people who want to be a physician, I would say be a physician, absolutely. But be open to how you use that to take care of your patients. And so, that's always opened so many doors for me. So
yeah, that's awesome. Now let's talk about advice for people who want to build their own company. That's a totally different mindset.
Yes, it is. And I'll say this too. Med school was very difficult, and I remember, like, the strain on my brain and the stress. The last 5 years has been exponentially more. Working with finance, working with the dynamics of building the right team and being a leader of an organization, and continually, innovating yourself and being competitive in the marketplace. Like, holy cow, like, very different. And so, again, being receptive to advice and seeking much counsel, I think, is the key. So I just have really tried to surround myself with people that say, you're a little shit, so there's my cuss word, but you don't know what you're talking about, man. You got to think about this. Yeah. And it's really hard sometimes to put your hubris aside, but you realize, gosh, there's people that have scaled amazing companies, and there's people that have scaled really crappy companies, you
Yeah.
know, and that's what amazes me too. I mean,
It is
you
true.
get out. I mean,
I love that. The skill it takes to scale a crappy company.
I mean,
is
honestly,
You
you
actually
know,
have
so-
to have more skills,
Yeah,
I think.
yeah, and so I mean, some of the people you have come in contact now with in the VC world that they're selling smoke and mirrors, you know,
Yeah.
as snake oil to the nth degree, and they don't understand, and yet they will scale it somehow, or they will turn it and this is what's sad, you know, about some venture capital is that you're just looking for exit, looking for building the impression of value for exit, you know, and so I always wanted to stay away from that too, but you know, surround yourself by smart people, I guess.
Yeah, I've heard
Yeah.
that quite a bit.
That's why I'm sitting next to you. That's right.
Yeah.
Rosh.
Yeah,
You always hire people smarter than you.
yeah, have to,
It
yeah,
makes your job so much easier.
Yeah, I mean, honestly, we have so many rock stars on our team too. Like for a while, I was like, I'm going to be the front person for everything, and I'm going to be at the sales things, and I'm going to build the technology workflows. And then I realized, like, gosh, I'm doing us
And
all.
I thought I was a control freak.
Yeah, exactly. I know. Yep. Yeah. I just make them report down to the minute what they're doing all day. That's it. Okay. It's not that big of a deal. Okay. Come on.
Exactly.
That's the number one reason for bureaucracy.
Yeah. Here's our 4,000 step plan for you to join our company.
Right.
Yeah. So you got to just let go. Yeah, absolutely.
I have one last weird question, but it's really coming from the spirit of how do we help? We're big supporters and believers of your organization.
Yeah.
And is there anything that the general population can do to spread the word?
Yeah.
How do we help?
Well, I mean, if you're in Duval County, then and you know people who don't have insurance, they can just look up Healthlink Jax or call 925-CARE. I mean, literally anybody can call it. And that's what we get people call all the time, like, hey, I just curious about this. My sister is uninsured. Well, how does it work? I'm just call the number, you know, and spread that word. So, you know, it's on the city of Jacksonville, Jacksonville.gov's website, you know, but if you just type in Healthlink Jax, you'll find it. And we just want people to use it and spread the word about it. So, and a big part of that is organizations doing that too. So yeah, that would be the local thing. I would say.
Good.
Yeah.
Awesome.
Yeah.
Thank you. Arash,
Yeah.
what did you like the most about Matt?
Well, clearly it's his good looks.
I know.
Yeah. And that's it.
That's it.
Yeah, that's it. There's really nothing,
Not a whole
nothing
lot.
really
Nothing else is
important
really
coming out of that mouth. Just keep
about you?
smiling. Yeah.
You know what they say about doctors? I mean, there's a lot.
Yeah.
But
Do tell.
especially,
I
especially
actually have one question, but go ahead.
nurses. You always hear the talking of, well, you know why nurses exist, really, because doctors are big a-holes and they
Yes.
just, float in, float out, sprinkle some information here, and everyone's like, what did he say?
Yeah.
What did she
I like
say?
the idea of an a-hole literally floating in.
Yes, yeah, just
sprinkling some things.
Wow, yeah.
The next step for our show is to have
Yeah,
information
you got to
and
overlay
graphics
some
in the
graphics over
background.
this. I mean, that's perfect.
No, but I feel like, when you are, I'm very fortunate. I love my primary care. Makes me feel at ease.
Yeah.
And it's not just because I'm crazy and he needs to calm me down because I'm going to make a scene. He's genuinely a nice guy. And the guy before that who retired, genuinely a nice guy.
Do you have a habit of making scenes at the doctor's office?
Depends.
Depends.
Yeah.
But I feel like there is a very big misconception that most doctors have this rough and gruff bedside manner.
Yeah.
And that's what, some of the nurses will say.
Yeah.
But you kind of took that away.
Yeah.
You seem like a nice guy.
Well, now keep in mind, I'm a fake doctor now. Okay. So yes, no, but listen, there's a
brought your
lot of really
personality forward
yes,
now.
yeah. There's so many great doctors out there. I mean, honestly, I'm blown away with like just some of the quality, and I think, and then yes, there are some rough and gruff.
Do doctors have clicks? Do the ER doctors look at the surgeons with the side eye?
Oh, great
And the
question.
surgeons look at the family practitioners.
Who's at the top
Yeah,
of
we
the
really
popularity?
No one likes
scale?
surgeons. No one likes surgeons.
We get in knife fights with dermatology all the time.
Dermatology?
No, I'm just.
I was going to say.
Yeah,
They
it's
seem
just
like
I'm
they're
just
nice
moving. No, they're
people.
so nice.
Yeah.
They're out making money. They're doing great. Yeah, they're super happy. No, yeah, and they only work like 4 hours a day, so
That's why my daughter couldn't get the appointment. she
Yeah,
needed.
yes,
There you
exactly
go.
right. Yeah, it takes me 6 months to go get something frozen off, but they're gonna freeze something off. They will every time.
And all of them have a YouTube channel.
Yes, yeah. I think
Why
so.
do they always want to do a full body scan and look in every crevice you have?
Yeah.
I literally canceled my
what- they
appointment.
don't-
I was like, I'm not doing that.
Sorry,
They're not
who's your
supposed
doctor?
to do that. Actually.
Wait, what?
No, I'm just kidding.
How do I get an appointment and how do I get it
Yeah.
quickly?
There are, certainly different perspectives, right? I mean, when you're a consultant, you are constantly being reached out to when you're on call after hours. So my good friend, he's a urologist, and he actually did my vasectomy. He lives like 3 doors down from me also. And I said, if this doesn't work, like I'm going to drop that 4th kid off at your house every day. So, but he's on call a lot. He has to share call with his partners. And so, when you're getting called, at night, it's human nature. You don't, sometimes it's necessary. Sometimes it may be perceived as not being necessary. And so just being respectful, I think, and some people are at the end of their road and they're burned out. And the first way they exhibit that is by being an a-hole, sprinkling fairy dust all over. So yeah, just like any other work, you got people who.
Burnout's real.
Yep.
Well, Matt, it's been an absolute pleasure.
Yeah.
Thank you for
awesome.
sharing all of this. Thank you for helping us spread the word. And yeah, now we're going to continue to talk about you behind your back right in front of you. Okay.
Good. Okay.
No, it kind of brought back a little bit of faith for me with everything that my parents have gone through and the amount of doctors that they have seen and the quality of care that I feel like my father hasn't received. It's nice to sit across the table and hear somebody who genuinely cares. They're not in it to make the money. Well, maybe he is, but they're not in it to perceivably make the money. They're in it to help people get the care that they need, but the sustainable care that they need so that people aren't living in fear and living with these ailments that they don't need. And so I think I lost a little bit of faith over the years with what my dad has gone through. That's my perspective.
Yeah, I love that. Yes, I can feel the same way. I'm just, when Matt's talking, what I'm thinking through is just my direct experience and how it's so hard to make an appointment. If I go to see a family doctor, a physician, and there is never follow-up, like I have to be the person to reach out. So the idea of having 360 care, that's ambitious.
I know.
And if we lived in a world like that, I feel like the health outcomes would be incredible.
They'd be so much better. And now I'm going, oh, what happens when I didn't get the full answer from my doctor? Can I pick up the phone and call Telescope Health? And
yes.
be like,
of course you can.
I don't believe what my doctor told me. I'm going to come across like a nut job. I know this. But I believe in preventative care. That's my pitch right now is preventative care. If you're not paying attention to what you're doing to your body, what you're putting in your body, as we are all aging, then you're going to have problems and they could start showcasing themselves, earlier in life. So for me, healthcare is very important. So I'm very passionate about it. And it kind of has felt like I'm just the only one who cares as deeply about myself. From that,
no, we all know you care deeply about yourself. It's clear.
From a health standpoint. But yeah, I want to know my doctor has my back.
Yeah. To that point, you just reminded me of my wife and the recent appointments she's had. And she's come home and said, I didn't ask the questions I want to ask. And that, it doesn't blow my mind that she didn't ask the questions, but her ability to go back to that doctor and to ask the questions or
you
to
don't
just
feel like
get a quick phone call. It's just, if I want to ask those questions, I have to make another appointment a few months out.
Right.
And
pay for that appointment.
Right. Pay for that appointment. There's a lot that needs to be fixed. And Matt's going to fix all of that.
I think he will.
I think that's
I have a whole lot of faith.
Yes. All right.
All right.
See you next time.
Episode 5. Done.
All right.
On to 6.
Done.